So, how would you feel if you went in for a surgery? Let's say something as simple as getting your tonsils removed. And while you were asleep, a doctor and several doctors in training performed a sensitive exam on you, like a pelvic or prostate exam, without knowing it at all. After all, you were under anesthesia, so how would you have known? Up until recently, doctors in most states were allowed to do this. Finally, and shockingly in 2024, this was outlawed at the federal level. Let me explain. A 2020 New York Times article more or less blew the lid off this issue. Hospitals across the country were performing unnecessary pelvic exams on unconscious patients, mostly women, to teach medical students how to perform them. In 2005, a University of Oklahoma study showed that the majority of medical students who were asked had performed a pelvic exam on unconscious women, and 3 out of 4 believed informed consent was not obtained. It's incredibly violating to have your body used without your knowledge or consent. The idea that so many people, mostly women according to the data, were used as teaching tools without their knowledge is alarming and just another example of women's bodily autonomy being taken from them. This issue has been somewhat of an open secret in the medical and medical training field for a while, with some physicians seeing it as a necessary part of their training and others pushing for reform. 20 states, including New York and Utah, even passed laws banning the practice and demanding consent. But now, the U.S. Department of Health and Human Services has decided that practitioners in all medical settings must receive written consent, confirming that patients would allow any kind of teaching exam, especially those concerning more sensitive areas of the body, to take place under anesthesia. The bottom line is this: consent matters most. Of course, we want our doctors to be knowledgeable, but give people the opportunity to say yes, or more importantly, no to the things being done to their body. It's about bodily autonomy, and we all should, keyword there, should, have the right to be able to say what happens to our bodies.